Hello everybody, I'm John Di Sciullo and welcome to Innovations in Health. If you have a dental concern, we're going to talk to you about mini dental implants. It's a procedure that could change your life. For the next 30 minutes, we're going to be joined by Dr. Doug Wright. Doug, welcome to Innovations in Health.
Good morning, John. How are you?
I'm doing well.
Good to see you.
Good to see you. And Dr. Wright, talk to us about the mini dental implant because it really is a revolutionary procedure for dentistry.
In one way, it's revolutionary. In another way, John, the mini dental implant is evolutionary. And we just looked throughout medicine of how small titanium instruments are used and accepted by the human body.
And the titanium is the actual mini implant that goes into the gum.
Exactly.
You have some models here to show us a little bit about
I've got a model that shows it beautifully. For 80% of the patients who get a lower denture, a complete lower denture where they have no lower teeth, it is a challenge to wear the denture. And you'll see on TV often there's advertisements for adhesives and so forth, all kinds of things to aid to keep that denture in.
But that denture and that goop,
that's
the
the
teeth
goop.
move around.
People hate that. They hate it.
And the dentures can fall out.
Absolutely, absolutely. And this is an example of a patient who has 4 mini dental implants. And you can see they're tiny. You probably have to get them on a close-up to really see what's going on.
And so those are titanium metal.
One piece, titanium metal. Many times patients will talk about problems they've had with other types of implants. Most other types of implants are 2-piece with the part screwed into the top and that'll come loose or break. This is 1 piece, incredibly strong, incredibly predictable. And in this part of the jaw, in the lower jaw, with 4 snaps to hold that denture in, you can say goodbye to goop and adhesive and insecurity. It's amazing.
And that snaps right in place.
Just like that, snap.
And that denture that was once moving around is now fit, and you can get that confidence
I joke
back.
with my patients, I say, now you can hang by your teeth at the circus. And most of them say they didn't want to do that, but they could if they wanted to.
And so that's the lower, and there's an
there's an option for the upper. Yes,
yeah.
There certainly is. And one of the things you'll notice is with the upper, many times we'd like to do 6 implants on the upper. This has more to do with the difference in the bone and the anatomy than it does with the implants, okay? It's the same type of implant. It's just that we know from the study of the human oral structures that you may need a little bit more help in the top.
And why is that?
The bone is different. The bone is different. This, in the lower part of the jaw, in this part.
And that's the example of the bone right there,
right,
the white.
Right, this is an example of a human mandible. And the bone is stronger, more durable in the front here.
So therein lies the difference. So
Sure.
let's show the upper again, because
Sure.
one of the things that you see sometimes in a denture is that you
I'm
have
glad you brought this up.
Yeah, you have that full, almost
plate.
like full plastic
Right,
plate there.
Right. And so many times my patients who've worn dentures for years, once they get the mini implants, they have an option to get this window into the denture. It makes them feel like they can taste better. A cup of coffee tastes better because they feel that heat on their palate. Everything just feels better to them.
So taste comes back, and imagine if you now had trouble eating into a great piece of steak, an apple, bacon, whatever. Now all of that taste and all of that confidence comes back
Sure.
in enjoying the food. And show how it snaps in, because it really is an amazing adhesive, not the goop, but the mini dental implant.
We have a lot of hunters and outdoorsmen in the Shenandoah Valley, and this makes it possible. One of my patients said I could finally eat some deer jerky again. And that just fills me up with so much happiness, because that's what we're here for. Not just to give you something that we can put in your mouth, but something gives you a lifestyle.
Yeah.
Gives you part of your life back.
And we talked about dentures, kind of the upper and the lower, but a mini dental implant is something that you can also enjoy if you just have a few teeth in the back of your mouth.
Very common, very common. I want to show you this model. This is typical. I've got a number of people in my practice who are missing a couple teeth on the upper left or upper right. They can function pretty well, John, but when they smile, I can see the space. With a CAT scan in my office, I map very carefully where the bone is, and I put the implants in where the bone gives us maximum support. And I have other equipment in the office where I can scan this, and with a computer-assisted design, we can make the crowns that fit in one visit.
And there it is, just a few teeth in the back. And what's important is that even if the teeth are not visible, those are the teeth most important for chewing.
Oh, absolutely.
And if the teeth aren't there, then the others move in your mouth can
Absolutely.
become problematic.
But I want to go back to this. You walk into the office with no teeth here, missing 4 teeth. You leave with a permanent restoration in there. It's just transformational. And you bring up another good point. If you don't have these back teeth, as you try to chew with the front teeth, you wear these front teeth tremendously.
Yeah.
And another way of looking at it is if a patient has 6 teeth on the top and 6 teeth on the bottom, you have 12 teeth, where they're trying to do the work of 28. It just, the whole system breaks down.
Not natural. And one of the pieces there is the single tooth.
That's correct.
And that is an option for the mini dental implants. So
Absolutely.
if you have a single tooth that you need,
that's great.
It can be formed right and show
sure.
how that works.
We scan this and make sure I know exactly where the bone is with the help of a CAT scan. The CAT scan is in my office. We scan it, we make the crown while you wait, and it gets cemented in and you go home with it that day.
And we should mention this is a less invasive, less discomfort, less healing time, less visits to the dentist, and it's a less expensive procedure than the old traditional implants.
And I'm glad you brought that up, John. I want to talk a little bit about what less invasive really means. In the old protocol for doing a dental implant, the dentist would make the patient numb, they'd make an incision, and they put a hole in the bone about that big.
And that's a pretty big hole.
That's a pretty big hole, yep. And I tell you what, if they're doing it to you, it looks a lot bigger, okay? Then you cover that up, put stitches in the gum, and then you wait 4 to 6 months for that to heal. Then you do another surgical procedure to uncover that implant, to put something in it called the abutment, which is screwed on, which may come loose for you as you go through function in your life. Now take the mini dental implant. You come into the office, we make a pinhole size opening into the gum, we put the implant in that day, and we either attach your teeth or attach your dentures to it. You go home with that in the one day.
It seems,
it's unbelievable.
It seems almost too good to be true, but it is absolutely happening, and this is a part of the technology that's making dentistry so advanced.
If you have dentures or you're missing teeth, I want you to speak with confidence. Eat the foods you haven't eaten in years, and say goodbye to those annoying adhesives and pastes. Hi, I'm Dr. Douglas Wright, and I want to give you your smile back with a unique procedure I offer called mini dental implants. With mini implants, your dentures are locked securely into place. No more shifting or floating. The procedure is quick, with little time needed for healing. It costs less than standard implants, and financing is available. Call today for a free consultation and see how a simple procedure can change your life.
Before I come to Dr. Wright, I had gum disease. I had no gum to hold my teeth in. I had a consultation with him, and a couple of weeks went by and I thought about it, and I started the procedures. We did the upper first, and then we did the mini implants on the bottom, and they are just wonderful. I smile more now than I ever have, and it's just wonderful.
And there's another consideration that you and I need to talk about, John, is that the average life expectancy for Americans is going longer and longer every year. I have a wonderful collection of 90+ patients in my office. I recently did 4 mini dental implants for a woman who's 90. She will be 99 at the end of this month.
God bless.
She's not ashamed of the way she looked because her denture wouldn't stay in. She doesn't have to have her food pureed. She's 98 years old. Now, if I meet a patient who's 60 years old, man, I got a plan for them to live another 40 years. When you lose your teeth and you don't have any implants in there, the bone dissolves. If it dissolves over time, 40 years is a long time.
The life expectancy is much different, and
Yeah.
as a result, and you can look so much better,
Right.
and enjoy meals,
Right.
and enjoy all
And
of the
have your
food.
health. I mean, you know, we know that good nutrition is tied to good health. How can you have good nutrition if you have this thing flopping around in your mouth?
Well, and so much about going to the dentist does indicate how your health is.
Sure.
People tend to forget that going to the dentist is just as important as going to a medical doctor.
That's right.
To getting a procedure.
Absolutely.
And you've been a dentist how long, Dr. Wright?
I've been a dentist for 30 years. So it goes fast, it really does.
Well, and you have a great career. You're in the Navy.
Yes.
And you have service at Bethesda
Right.
Naval Hospital.
Right. I got out of dental school in 1985. My undergraduate degree is I'm a pharmacist. And so I've been looking at and working in healthcare since I was 17. I got out of the dental school and I joined the Navy. My first duty station was with the Marines at MCRD San Diego. It was a recruit camp. And so we saw a tremendous number of patients. It was a wonderful place to be a dentist. I had some wonderful mentors. And then I did 2 years on a Navy warship. And I came home and started a practice in Maryland. I was invited to teach at the Veterans Hospital in Washington, D.C., so I sold my practice in Maryland, and I worked with our nation's most worthy patients at the Veterans Administration. And when I was at the VA, I started doing more and more of the removable dentures. Many of our patients were older. And what I would see is no matter how well I made a denture for them, Some of these patients just could not wear a denture. And it may be that they were old. We had some patients who had strokes. We had some patients that were wounded in combat. And wearing a denture for them was not an option, and there was no other way to put teeth in their mouth. So I worked very closely with the surgeon at the VA hospital, and I started learning about how to make the denture set on implants. When I opened my practice in Harrisonburg, Virginia, I had to be more self-reliant. And then we started looking at the option of mini dental implants for my patients. I've been doing them since 2007. So this year we'll have 10 years of experience with the mini implants, and I'm just so excited about it.
Well, first of all, thank you for your service.
Oh, you're welcome.
And all of the great work that you've done for our greatest generation, too. And we should mention, too, that in Harrisonburg, you know, you are very unique in that this is happening, you know, in the Shenandoah Valley, in the friendly city of Harrisonburg, and it's happening in your office.
Right.
So when someone comes in for a consultation, the consultation is free.
Yes.
And what do you discuss with the patient when they come in? Somebody who's out there right now watching saying, you know, I think I might be a patient, a consideration for a mini dental implant. What is that discussion like?
Number one, it's free, totally free. You come in the office, if you say on the phone, I'm interested in implants to hold my denture in, or I'm interested in implants to replace some missing teeth, you'll meet Allison McLeod. She's our new patient coordinator, and she will help you get your CAT scan. You don't pay for the CAT scan. We use that to analyze how acceptable your bone is for this procedure. You sit down with Allison and she reviews your health history, and then we get a chance to talk a little bit and decide if and how we can help you with implants.
And you have a very unique process. You have a sort of a 3D imaging.
That's right.
So if somebody comes in, you can take the imaging of their mouth and determine in a three-dimensional way just what needs to be done.
Right. And I'm, you know, John, I'm glad you brought that up too, because many of the patients who are coming to me have had CAT scans at the hospital before. This is somewhat different. You don't put your patient in a big tube where they have to lay out and hold real still.
Right.
It's a very friendly, round-the-head x-ray, very similar to other x-rays that you probably had for your dental work before. But the magic is in the software, and how it takes those different shades of gray on the computer and actually gives me a three-dimensional look at the bone from every different angle.
And we should mention that these are American-made products. So the titanium, it's very safe.
Oh, absolutely.
It's something that is FDA approved.
It's a wonderful company. It's American-made.
And the teeth themselves, not only the dentures, but even if it's just a few teeth or a single tooth, these are hard teeth. These are not going to be, you know, diminishing.
The other thing you bring up is very important, is that these teeth that you're talking about, either the single tooth or the dentures, are entirely made in my office. We have total control of the quality. I have my own dental laboratory on the facility. I have a lovely team of people who can help get your smile just the way you want it. Sometimes, John, we even ask the patients to bring in pictures of when they had teeth, because teeth are different. Some teeth are different in size and shape. Some are more pointed, some are more flat. We can give you that look back just the way you want it.
And you have a great team. You have Smile with Confidence. That's what your website says, harrisonburgsmiles.com. That's where you can find out all about you. And you have like Dr. Michael Kennedy there, you know, some other folks who are in your practice to do all kinds of dental work.
Let me tell you about Mike Kennedy. Mike Kennedy is a great associate. He's had 27 years of experience in his own office in California. His wife's family's from Virginia. His kids are moving to Virginia for the opportunities that are here, and he decided he would sell his practice and come to Virginia. And we have all this wonderful experience, and he's got a lot of experience doing the aesthetic work with porcelain veneers and crowns and bridge work, and already he's made big improvements in the community.
Well, and what's nice is that you're in the community. You know, you're right here in Harrisonburg, and you're helping people. And somebody who's watching this might think, well, okay, if I have a mini dental implant or some of this higher-end dental work, you have to go to Baltimore or Washington, D.C. That's not the case.
No, it isn't.
Right here in the Shenandoah Valley, it's happening right here, and you're at 1451 Brookhaven Drive, not far from anywhere.
It's right by the RMH Hospital. There's a new Walmart grocery store right across the street on Port Republic Road. It's very convenient and easy to get to.
And we mentioned your website, harrisonburgsmiles.com. What's the phone number, Dr. Wright, where people can find you?
540-432-6616.
And we talked a little bit about the customization, and it's happening in your office. And at some point, somebody's going to say, well, boy, this sounds like it would be an expensive procedure. But you're able to work with the patients. Talk to us about how you work.
John, you're reading my mind. This is great.
I am.
We talked about less invasive, and that's really cool. And we talked about the convenience of how these things hold your denture for you. But the other thing is I'm committed to is to make sure they're less expensive. In my office, Every implant, mini implant, regular implant is $995. You will not find a less expensive option. Some feedback has come to me and said, well, what kind of implant is that? These are American-made, high quality, and we've been doing them for 10 years.
And you have a staff that works with the patient with insurance.
Absolutely.
And
absolutely.
You also have an opportunity, if you come in, that you can work with the patient for extended payment plans through some services that are available.
That's exactly right. We can make it so you make a monthly payment with no interest. We can help you out with financing in the office and getting the maximum from your dental insurance company. My ladies have a lot of 10 years of experience doing this for people. And we have an option where if you are fortunate enough and you can prepay, there is a significant discount available.
And we should mention that this is an investment not only in the cosmetics of it for the individual that might say, well, you know, my smile isn't what it should be. This is an investment in your health. And as you had mentioned, with life expectancy much longer now, this is an investment in your future so that you can feel more confident, you can be healthier, and you can certainly live your life the way it should be lived without that fear and apprehension.
John, the most common comment on follow-up, I see a patient maybe a week after I put the implants in, the most common comment is, why didn't I do this sooner? Why did I wait for this? Why did I put up with the partial denture that was loose? Why did I go around worried about the tooth that's missing? It's easy, it's comfortable, and it can be done quickly.
And let's talk about some of the patients that have come to visit you, Dr. Wright, in Harrisonburg. There's some great stories that you have to tell.
Oh, sure. You'll see later on in the show, I think, Kelly is a dental assistant, and God bless her, she let me do this the very first time. It was over 5 years ago, where we put 2 little implants in her jaw and put her teeth in one visit.
My husband came down and I was chopping away on bacon, and he said, "You're already eating on your implant?" And I had just forgot about it because it felt so natural to me.
She forgot about the implant, and the next morning she was having breakfast with bacon and chewing away. The first guy I did this for is a guy named Dwight, and I love the guy. He had a complete lower denture, and I put the 3 implants in there for him. I didn't have room for 4. And I got a letter from him a couple of days later saying, "Doc, I had bacon for the first time in 20 years. I could chew. And it's changed everything."
And taste it.
Oh my gosh, yes. Yeah. Oh my gosh, yes. And chew it up and swallow it without worrying about, you know, all the indigestion and so forth.
Yeah.
So
why is it, Dr. Wright, that some people have that apprehension to go to the dentist overall with all the issues that they have?
Part of it is we don't want to be treated like an impersonal environment. If you take time to get to know the patient, and I tell my staff, get to know this person, find out what it is that they do, find out about their grandkids or their children, really give some effort to really get to know the patient. Treating them is easy. And they'll tell you, this is the most comfortable I've ever been at a dental office. It's no secret.
I just wanted to let you know that I am a patient of Dr. Wright's, and he did many dental implants for me, 2 of them. I was able to eat the same day, and they are beautiful, and it was actually a very painless experience. I will have to say I am so happy with them. Wish I had gotten them a long time ago, but now they're there and they're permanent, and I don't have to mess with them ever again. It was wonderful and will be for a long time.
The mini implants have done a great job. No pain, no nothing.
Do it.
And I think that's important to note. And, you know, here we are in Harrisonburg, Virginia, and we were serving Stanton and some of the other great areas of the Shenandoah Valley.
We have patients that come from Franklin, West Virginia.
Yeah.
We have them come up from Monterey in Highland County. I want to say hello to my friends in Monterey. All the way down to Stanton. We have patients coming from Charlottesville. Sure. Got a wonderful family that rides down every twice a year from Pennsylvania to see me.
There you go.
Yes, sir.
Because part of that is the connection they make with you, Doug. And,
sure.
And some of that also, too, is the fact that it's all happening right in your office.
Exactly
This is something
right.
where if you have the mini dental implant and you're having that procedure, it's all happening right in your office. And we should state, too, that, you know, once again, if you're just tuning in and you're looking at this going, well, what is that mini dental implant and how do I kind of fit in? It's a less invasive, less discomfort, less healing time, less visits to the dentist, and less expensive.
Absolutely.
Yeah.
I don't want to interrupt you.
No, that's okay. Jump in. It's your show, Doc. It's your show.
Oh my gosh, I'm excited about this. That's why it's hard to keep my mouth shut.
And let's take a look again at these examples that we have in front. But if you have dentures and you have that issue where they're moving around and that goop that you put into your teeth, look at how this can change your life.
Okay. Now the other thing you have to put in, it's not just the goop. You know, there are folks, for instance, like what you do for a living, or folks that work in the clergy, or people that work in sales, that live in abject fear that their teeth are going to come out while they're talking to somebody, okay? And this takes away that fear. Absolutely.
And let's talk about the care, because you have to go, obviously, to the dentist to get care for your teeth.
Very important.
And care for your mini dental
Very
implant
important.
as well.
Yes.
How does that work?
What we ask the patient to do is take this out every day and leave it out overnight if possible. Some of my patients like them so much they won't leave them out overnight. But you have to take it out. You take a little bit of toothpaste on a brush and brush this carefully. Right after you get the implants in my office, we're going to give you a pediatric toothbrush, and we're going to give you a liquid called chlorhexidine gluconate. It's an oral disinfectant that we use to make sure that you don't get an infection around the implants when they're first put in. We give you a pediatric brush because the bristles are soft and hold a little bit more of that liquid. They dip the brush in the liquid and simply brush your teeth with that twice a day. Okay? Some of my patients like the liquid and they want to keep using it. Totally fine. It's an oral disinfectant, it just will help you out. Toothpaste and toothbrush will do just as well.
And that's for the full set of dentures?
Well, yes, for the full set. Now, of course, with a case like this,
this is the few teeth in the back there.
right, and you'll see that this is all put together in one piece. You can't possibly get the little brush under there. We'll give a patient a water pick to make sure they can get up under that and keep it clean. Water pick's a wonderful instrument. Some of my patients are very good with getting floss under there, and that's just as well. It's just like you have a tooth. The titanium doesn't get a cavity in it, and there's no nerve in it, so you don't get that toothache pain. But you do have to keep that little ridge between where the implant is and where the gum is. You have to keep it clean.
Yeah, I mean, obviously you would want to make sure that any dental care is done the right way.
Sure.
And so you need to follow these procedures. And how many times does a patient have to come back to see you after the mini dental implant has been in place?
And an excellent question. If they have their own natural teeth, for instance, this patient who has the mini dental implants and they're holding in their own natural teeth, we'd like to see that patient twice a year, just like we do with any other dental patient. If they have nothing but the implants, we can see the patient once a year. Now, I can't stress this enough. We do once a year for an oral cancer check. That goes with everybody. Oral cancer is on the rise in the United States. We're constantly looking for that. But the other thing that makes the mini dental implant so successful, the little snaps inside the denture has a little rubber ring in it. And that little rubber ring is your shock absorber. When it goes on there and you're chewing, it just gives just enough to protect that implant from being rocked out of the gum.
And you want to make sure that that is in place and secure.
Sure.
And held right. We're talking to Dr. Douglas Wright, and if you're just joining us, you're at 1451
Brookhaven Drive.
and that's in Harrisonburg, in the heart of the Shenandoah Valley. The friendly
city,
and
yes.
you're a friendly doctor.
Oh, that's great. Thanks, John.
And one of the things we should mention too, if you need more information and you want to look it up online, go to the website harrisonburgsmiles.com.
That's right.
And harrisonburgsmiles.com, you'll get a chance to read more about the mini dental implant procedure. You'll see some testimonials from your patients and find out more about Dr. Doug Wright and his team. And we talked a little bit about cost earlier and the fact that your smile makes a big difference in your life. And this is an investment, but it really isn't that expensive. And I think that's something we want to reiterate again. This is something for $995. That's your base. That's
per implant, okay? And that's where we start. I know that the price per implant is the least expensive implant you'll find anywhere, okay? And some of the things that we're talking about, we work hard to make sure this is an affordable option for our patients. There are some other options out there, and if you watch TV, you'll see this thing called All-on-4. The All-on-4 option is a viable option for patients, but what they do is they'll put 4 normal-sized implants in the jaw, wait for healing, and make teeth for the patient. Sometimes that can be $40,000, $50,000, John.
That's amazing.
And it's so out of reach for most working people. This is much less expensive than that, and that's what we can do for you. Something that's reliable, it's functional, it's predictable, and nobody's going to know you have dentures. That's wonderful.
And Dr. Doug Wright is a published author. You've written lots of different articles.
Absolutely.
And talk to us about some of the articles that you've published.
The Daily News Record, our local newspaper, has an open forum section, and they've been very kind to let me publish, probably 20, 25 articles. I publish articles in for professional articles in the Navy, Naval Proceedings magazine. That's where Tom Clancy got his start. I recently published in Implant US, a dental journal that highlights how my experience with mini dental implants. You see, John, there's a big change happening in dentistry, and there are a lot of practitioners that are absolutely married to this old concept, to this concept that you have to have this very large, very invasive hole put in your jaw to get an implant. They're wrong. And the only way you can get that word out there is to write about it and be a bit of a missionary for something different, okay?
And you've been taught by the best on what the mini dental implant procedure is all about, and you've been practicing it for well over a decade now.
Yeah, we started in 2007. I was very frustrated that my patients were being charged an awful lot of money for a couple of implants to stabilize a lower denture. So I flew to University of Oklahoma, where the dental school had a program to teach dentists about mini implants. I took their program. I went and met Dr. Todd Shacken from Buffalo, New York. He's a great guy. He's a wonderful, energetic, very motivational teacher. And Todd has published one of the seminal articles about mini dental implants. He and his brother have a practice, and they looked at 5,200 implants. John, 55,000 implants he looked at.
Amazing.
Okay, half of these implants were supporting a denture. Half of these implants were supporting like a crown like this, you see? And he found out with that research that the mini dental implants are as successful, in some cases more successful, than the regular implants, okay? That study is the study. Other studies have come along and confirmed Dr. Todd's findings. So anyway, I studied with Todd Shacken. I met a fellow in California named Ray Choi, who was barking up the same tree. He's working with mini implants. I've recently spent a week in Cartagena in South America looking at the same issues. How do you get implants in places that are tiny, tiny, tiny places?
Wow. Dr. Wright, and you're right here in Harrisonburg, Virginia.
That's right.
This is where you can come and see the doctor and meet his staff at 1451 Brookhaven Drive. So all of this experience, this world-class experience,
Right.
is available right here in the Shenandoah Valley.
And John, the consultation is free. We take the CAT scan, evaluate the CAT scan, you meet the patient, they meet us, they see the staff, they tell us what their concerns are, and we put together a plan that can help them. That's free.
So this is a smile with confidence, almost guarantee, if you will.
Almost.
Yeah. All right, and we're going to find Dr. Wright at 1451 Brookhaven Drive in Harrisonburg, Virginia. Give us your phone number one more time.
John, the phone number is 540-432-6616. And when you call, you will talk to some of the nicest people you've ever met.
Well, thanks for joining us on Innovations in Health, and thank you for telling us all about the mini dental implant experience.
John, thank you for having me. It's been great.
Thank you very much. Thanks for watching Innovations in Health.